my name is Austin Slight. This is my wound care video. Here is my student ID badge. I will now proceed with my wound care video. So the first thing I would do is I would identify the client with two identifiers, name and their birthday. I would check that with their wristband. I would explain the procedure that I'm doing and how long it'll take. I will assess for allergies and any pain that the patient is having. I would close the curtain for privacy, place all the supplies on a clean surface, and perform hand hygiene. On to my wound care, I would start by raising the bed to a comfortable level for myself, lower the side rails, and make sure that the wound is easily visible and easily accessible. So I would then perform hand hygiene again, prepare all my clean supplies, and don clean gloves. Alright, after donning clean gloves, I would then expose the wound, keeping modesty from my patient, undo any old dressing, a minor discharge from the wound, no smell and no discoloration of the surrounding tissues. I would then discard those into a receptacle, and I would then measure my wound. I would measure height and width. The height is about 10 centimeters. The width is about 8 centimeters. And then I would do depth by using a Q-tip, putting it into the deepest portion of the wound, sliding my fingers down till I can reach, until I can't go any further, and measure the wound. The depth seems to be about 2.5 inches, or centimeters. And then I would discard these. And then this is where I would remove my first clean gloves. Before I do that, I would assess for any tunneling or undermining. There doesn't seem to be any on this particular wound, so that is not necessary. I would then remove these clean gloves, perform hand hygiene again, and don a new pair of gloves and any other PPE that is needed. I don't have a second pair of clean gloves, so I will just pretend to take them off, hand hygiene, and put on new ones. Then I would place another clean thing underneath the patient to ensure drainage after I do my sterile saline. So I would take my irrigation syringe, put the tip only into the sterile saline, absorb more, and then from top to bottom in a Z-like pattern, I would irrigate the wound, letting the drainage run out onto the pad. Then I would take a clean gauze and pat the wound dry, and being sure not to use any touched part on any other touched part of the wound. And then with another part, wipe around in one circular motion, discard the gauze, and then I would remove the clean gloves, perform hand hygiene. Now onto the sterile dressing application of this portion. So I would get all my things into a sterile field, my dressing change tray, and my two sterile Q-tips. So then I would do this. I would open up the tray front to back. These were already opened. I would then open them up and dump them in. And then discard. So the only thing I could touch right now would be the gloves. So I would take out my gloves, make sure I have a clean area to unwrap them in. Only touching the outer parts. Only touching the outer parts of the gloves, of the packaging. Being sure not to do not want to unwrap today. So unwrap. And then the only parts of the gloves I can touch are the cuff. So I would take the cuff and then slide my hand into the glove. Being sure not to rip the glove. I had to substitute my own because the other ones did not fit and they ripped on an attempt. So then I would take the other part and underneath slide my hand in, and then I can actually touch the outside of the glove like this because my other glove is sterile as well. I got my hands in my sterile gloves, and now I can touch any part of the sterile field. So what I would do is I would remove anything I don't need. I have different tape or actually I would use this tape. This tape, the tape part does not need to be sterile, so I would remove that, put it over there. This is a pad to use. I already have a pad, so I will not be needing that. Then I have that's nice. Did not think about that. They have a dressing change stamp in here. We'll use that for later. I will put that over with my tape, making sure not to break sterility. I have, looks like a trash bag for my other things. I do not need that, so I will remove that. Scissors, do not need, remove. ABD pad is right here, so I'm going to move these over here, still not breaking sterility. A roll of gauze. I will not be needing this at the moment, so I will also remove that. So the next thing I would do is, in here I have sterile saline. So I would then open the sterile saline. Peeling back, oh God. Oh, good Lord. I got it. Open up the sterile saline. Throw it away in a proper receptacle. And then with the label facing away, pour in the sterile saline into the area here. We are done with the sterile saline, so I will put that away. And then with gauze, we want to make sure we air it out, stretch it out, and put it in the sterile saline solution. I don't need a lot for this small wound, so I will only be using 2 things of gauze. I will air it out, make sure it is nice and fluff, and put it in the sterile saline solution. So then what I would do is I would take 1 piece of the gauze, make sure it is damp but not fully wet, so wring it out and then fluff it back out. And here is where I would put it into the wound, making sure I cover all of the wound. So with the sterile Q-tip, I would move the gauze, into the wound, making sure it's aerated properly as to cover and not make sure everything is covered as to promote healing, trying not to keep it inside the wound, not spilling onto the outside of the wound. Packing the wound. Okay. Get the next piece of gauze, wring it out, And then also letting it air out. Putting it inside the wound, packing it using the Q-tip. Keeping it inside the wound. So packing it with the Q-tip, lightly packing, allowing air to flow inside the wound as to promote more healing. And then after that, I would throw away my Q-tip, take a dry gauze pad, and put it over the wound like that. And then this is where I would also take my ABD pad and put it over the wound. But since the wound is a little small, I'm not going to be using the ABD pad. What I will do is I will take one more piece of gauze and put it over the wound. To make sure that it stays nice and covered. I would then take my tape, since this part is now no longer the sterile part of it. I would take my tape in a window pane like fashion. Oh, don't stick to my hand, please. I don't know how well it's gonna stick to my wound, but I'm gonna try. In a window pane like fashion. So one side. Does not like me. It should be flat, but it's stuck to my glove. So then I would do it again on the other sides. As best as possible. Making sure it's flat. Hold on. Where'd the rest of it go? I need one more. There it is. One more piece of tape as a window pane. So my wound is now dressed. So now I would take, so this looks like, this is a dressing change. I would use this. So I would, actually I'm gonna just use a normal piece of tape for this. So what I would do is I would take my piece of tape and then write my initials. So AS. The date being the 28th. So 7/28, I believe, is the date. 28. And the time is 1947. And then I would put that on the corner of my dressing. And then after that, I do not write on the patient. I only write on the piece of tape and then stick it to the patient. I would dispose of all my stuff in the proper receptacle. Remove my sterile gloves. I would remove, okay. So before I remove my sterile gloves, I would take out the padding under the patient, throw that away also in the proper receptacle. Then I would remove my sterile gloves, perform hand hygiene, lower the bed, lift the side rails if I lowered them, make sure the brakes are on, ask the patient if they need me to do anything before I leave the room, and make sure their call light is in proper reach. That is my video on wound care. Thank you.